Welcome, everyone. We are going to begin in just a minute or two. Good afternoon, everyone. Welcome, and thank you all for joining us this afternoon. We are so pleased to see so many participants join us virtually from all over the country, and we are in for a treat this afternoon. My name is Una Osili. I am the Associate Dean for Research and International Programs at the Lilly Family School of Philanthropy. I also have the honor of serving as the Dean's Fellow at the Mays Institute on Diverse Philanthropy. I'm delighted to moderate the panel discussion today and look forward to all of your questions. I'm going to encourage everyone to start sending in their questions via the Q&A function that's available to all of us. And we've already received some questions ahead of time, so I think this will be a very lively discussion. Just a quick update and to share with you, the Mays Family Institute on Diverse Philanthropy is the newest institute at the Lilly Family School and fosters a greater understanding of the ways that diverse cultures and backgrounds are both inspired and informed as donors. And we provide knowledge, education, and training about diverse communities within philanthropy. I have the distinct pleasure of being joined this afternoon by two esteemed colleagues. Marie Argilagos is the president of Hispanics in Philanthropy. She has a long track record, a successful career that has spanned philanthropic, public, and nonprofit sectors. Prior to her role at Hispanics in Philanthropy, she also served as a senior advisor at the Ford Foundation and also as Deputy Chief of Staff and Deputy Assistant Secretary at the U.S. Department of Housing and Urban Development, HUD, where she created the Office of International and Philanthropic Innovation to help bring collaboration between public and private sectors. She has a long track record of leadership across many different organizations, and I'm really just delighted to have her join us. Maria is our other esteemed colleague. Maria del Socorro Pesqueira is the president of the Healthy Communities Foundation, where she served in that leadership role since 2017. Her track record as an award-winning visionary leader addressing a number of complex issues at both the local and national level, spanning health disparities, immigration reform, women and family issues, violence prevention, and the future of philanthropy. Prior to joining Healthy Communities Foundation, she's also served in leadership roles across many organizations, including Mujeres Latinas en Acción, and also she led the National Museum of Mexican Arts Development and Marketing team. For both of these leaders, justice, equity, collaboration are key values and core values for them. And I am just thrilled to have both of them join us today. So let me just start by saying welcome to both of you. And we are already getting questions through the Q&A function, so we're going to be very busy today. I also wanted to mention that they were both supposed to be here with us at the Lilly Family School in person, and we still have that invitation open, and we hope you can join us eventually in Indianapolis at some point. So warm welcome to you all, and let's go ahead and get started. The very first question that we wanted to start the discussion off by just saying that the COVID pandemic, as we all know, has upended our daily lives and will have long-lasting economic, political, and cultural consequences. as we try to make sense of both the global crisis and the local crises that all of us are facing, this is a chance to actually lean into many of our core values. So I'm going to ask you all to just start by telling both of you, telling us about your own backgrounds, your journey as leaders, and the organizations that you lead, what propelled you to those leadership roles, and what are the factors that have shaped your career path? So we're going to start with Ana Maria, who is the CEO of Hispanics in Philanthropy. Tell us about your early experiences in philanthropy and how they have guided you on your path as a leader.
Thank you, Una. Buenas tardes and good afternoon or morning to some of you. I'm really sad not to be there with you in person, but we'll do this again sometime soon, I'm sure. As Una said, I am the president of Hispanics in Philanthropy. I've been here for 2.5 years of HIP's almost 40 years of existence. The organization is really special in that it unites philanthropists, foundations, Latino serving organizations, often nonprofits, and other allies. And our focus is strengthening leadership, influence, and equity. We do this primarily by leveraging philanthropic resources. I think what's really cool about our work is that it spans across both the US and the Americas. And so we're working across the entire hemisphere. We have people in communities, like we have a Latin America office that's run out of Mexico City. We have people in Central America. We have people on the ground. I'm usually in DC, but we have New York, Illinois, California, Texas, Arizona, Florida. So we're very both on the ground local, but we're also hemispheric. And that's important because today's very complex problems, they span borders. And so they have to be addressed through this lens. How did I get here? It started really when I was very young. I was a teenager and I was living in the city of Miami. And those of you that remember the murder of Rodney King, and it really does transcend many decades. He was murdered by the police in Miami, and then he was acquitted, and that then ensued was a whole entire week of protests. And I used to work at a pharmacy, and I remember going to the top floor of that pharmacy and looking out and seeing the whole entire skyline of Miami and the city burning. As a really, as a teenager, as a young person, the sight of the city where you're growing up, having that burning is just the physicality of that. Even though you're not prepared for something like that, it just puts a fire in your belly, and it's a fire in your belly that never goes away to fight the inequities, and it's shaped who I am. And so I've walked this path throughout the decades, and it's brought me to work at a variety of like community-based organizations where I was started as an organizer, and then national Latino organizations. I've worked at 2 foundations, as you mentioned, and as a political appointee in 2 administrations. And I'm now here at HIP. It's an organization that's rooted in practice and leadership that I'm really proud of, because it's moving capital with an ethical and a social justice orientation. We're very much about collaboration, convening, and we would say in Spanish, corazón. And we're really focused on women, on BIPOC, Black, Indigenous, people of color, who are most impacted by the structural and institutional racism that is all around us and has been around us for decades and centuries. This year alone, we've been able to move over $10 million in COVID response, and that's not just to nonprofits, which have been the bread and butter of who HIP has worked with over the years, but also to cash assistance to individuals, to farm workers. We even have a fund for businesses which are failing, Latino businesses. 30% of them we've already lost just between April and October. So we've put out $10 million for COVID response this year, and our staff is on the ground working to address not just the pandemic, but also advancing democracy, workers' rights, migrants' rights, gender justice, lifting up all of the positive stories about the role of Latinos in our recovery and in our future. So it's been really fabulous, and we're very honored to have Maria on our board as of this year. So Maria, why don't you go ahead and introduce yourself?
Great. Well, thank you. Thank you, Ana Mari, for sharing. And thank you, Una, for this invitation to share my journey. And, as you were asking specifically about my journey, I've served as the president of the Healthy Communities Foundation for about 3 years now. And reflecting some of my earliest connections with philanthropy, they weren't necessarily traditional philanthropy, but they were what you would consider traditional philanthropy, or one might. I recall early on the importance of philanthropy in my family when we first came to this country, in sending money back to Mexico, sending money back to relatives, and recall the various when there were different natural disasters taking place, and Telemundo or Univision showing the telethons. My mom, not very making much money, making those phone calls or asking me to help her process that. So personally, philanthropy is traditional and personal to me from that perspective. Professionally, my first role was on the grant-seeking side in the nonprofit development at the National Museum of Mexican Art. Back then, it was the Mexican Fine Arts Center Museum. And interestingly enough, I didn't really know very much about development when I first started that role, and I learned on that ground about what is this world of philanthropy. But I came to realize that it is about building capacity, and that building capacity at that particular moment of the museum for building capacity of communities via bringing resources to make that happen. It taught me to take risks and welcome challenges, and I worked at it from that grassroots perspective at that community level. And so I have to say that I was fortunate. I had very good mentors, and mentors that were very much involved with philanthropy, and individuals who also saw philanthropy as good business, and that philanthropy can be a two-way street. Now, I got to quote Edgar Villanueva in his book about philanthropy being that philanthropy is reciprocal, and I saw it early on. So as far as prior to joining the Healthy Communities Foundation, I was on the board of another health conversion foundation in our area, the Community Memorial Foundation. And there I understood the importance of good stewardship in philanthropy, about governance, and the power, truly the power that foundations have to make change. And to make change, it's also about being inclusive of community and the needs and the voice. So, after my time at the museum at Mujeres, and certainly on the board of a foundation, I had the opportunity to come to the Healthy Communities Foundation, that was created from the selling of a hospital, and a community hospital. And interestingly enough, it's been a full circle moment, because I remember growing up, going to that same hospital as a child and translating for families, for neighbors, for individuals in our community, and talking about being reciprocal, right? So as a woman of color, there are very few Latinas in philanthropic leadership. And I want to highlight the importance of having individuals and representation of people of color, or BIPOC folks of color. And I think I was fortunate in the sense that I recognized that role and that opportunity of making systemic changes. And I recall seeing Luz Vega Marquez, as the president of the first Latina president of a major foundation. And I said, wow, she is making things happen. And so the idea of having more Latinas, more women of color, more individuals of color, BIPOC folks, seeing folks at the board level, as well as leading institutions, is truly important. You also asked about COVID and the work that we're doing. Um, and so certainly this dual pandemic of COVID-19 and systemic racism have revealed the systemic inequities and racism that have impacted Black, Latinx, Indigenous, and immigrant communities for decades. So at the Healthy Communities Foundation, we were uniquely positioned to respond quickly to the pandemic. And that's because 3 years ago, our foundation restructured our relationship with communities in our region and applied a health and racial ethnic lens to our grant making, but also to our internal policies and operations. And because of this, we've been able to understand what was happening in the Latinx communities before public health data could show it because of our community embedded approach. And most notably, with the full support of our board, we dramatically increased the total grant making for funding for this year. And this was possible because of our belief that annual giving should not have a ceiling just to protect our endowment. We simplified our application process and renewed most of our general operating grants for most of our partners. And we accelerated funds disbursement to our partners so that they could adequately plan. And we're also have been intentional as to where these funds are going. We've prioritized to communities where without access to a safety net. The zip codes in our region most impacted by COVID-19 are in Latinx communities. And they have experienced high unemployment rates, were denied stimulus funds due to mixed status families, and are overrepresented among essential workers. So what COVID-19 has demonstrated to philanthropy is that we can swiftly make change. And although that cannot happen without data.
This is fantastic. You have covered so much ground here. And I'm just so pleased that we have you to give us that front row seat in this crisis. I'll just ask a quick follow-up question on the COVID question. We have, as you know, the data shows disproportionately that communities of color, especially Black and Brown communities, are affected by the pandemic. And as a leader in this crisis, what are you learning about your own leadership strengths in this moment? Anything that really resonates that you could share? Because in the audience, we have lots of students, we have faculty, we have so many that are hoping to learn something. So I just wanted, if you had something just that you could reflect on that has been very eye-opening from a leadership standpoint.
I got one. Self-care.
Self-care.
It's not intuitive because when there is an emergency like this, I mean, we were already working on emergencies for the past several years. Since I got to HIP, I feel like I've been working on emergency after emergency. I got to HIP and then we were hit with the family separation crisis and kids in cages. And so it feels like it's been running sprint level, but you can't run at sprint level for years and years. And you can't really run a healthy organization if you're doing that to your staff. And so it has to start at home and you have to model self-care so that you can be effective and you can have time for regenerating so you can be creative and nimble because this world requires us to be creative and nimble. And so I think you have to, it's not intuitive, but you have to start with self-care and then model that so that your staff is also practicing self-care, and that way we can then respond to the urgencies that the community requires of us. So that's been my big learning. So I've been exercising and sleeping now more than I used to, just knowing that it's more important now than before.
That's a good point for our students and our community and everyone who's listening. Maria, how about you? I think this is a great way to start our conversation.
Thanks, Una and Amadi. I think it's a reminder of our privilege, the privilege that we have in our work in philanthropy. And with that certainly comes responsibility. And I love Anamadi's point about self-care. I'm reminded of, when we were flying more, you were told make sure that you put your mask on first in case of an emergency. And so, certainly that's very important that we've got to put our mask on first. So that self-care is important, but it's a reminder of our privilege and responsibility as well, in this moment in time, to listen to community, to listen to, and to be, to not forget that, that in this moment in time, philanthropy has a major responsibility to those on the ground, especially from a hyperlocal perspective. So those are the two that come to mind.
That's fantastic. So self-care, but also understanding our role in the philanthropic sector. We have to lean into this moment and do more. Even though needs are mounting, we must embrace this moment with urgency. Now that gets me to a question that actually we've been reflecting on. As you all know, the Lilly Family School is the world's first school. And as we prepared for this event, there was a lot of internal debate about the right term to use. As everyone on the webinar today understands, the terms Latino or Hispanic commonly refer to people in the US born whose ancestors may have come from Latin America, whether that's Mexico, Central and South America, the Spanish-speaking Caribbean, over 20 countries. However, there has been some evolution in terminology. Recently, the Pew Research Center reported that in a national survey of Latinos, over 3,000 respondents, very few, only 3%, self-identify as Latinx. So I want to pose this to our distinguished panelists today. What is the most accurate or relevant pan-ethnic terminology to use when identifying Hispanic or Latino communities? And how does this differ across the country? Both of you have had the pleasure really of traveling before COVID. What patterns have you seen in terms of how communities are self-identifying in this moment? So we could certainly start with Maria and then go to Anna Marie.
Sure. So certainly, so thanks, Una. First of all, the term itself, it's an umbrella term. And let's recall that, as you stated, that the term Latino, Latinx, Hispanic, being an umbrella term is encompassing of the diversity of a population that is diverse economically, politically, and culturally across the country. So let's recall that, and I think that's really important. We could spend a lot of time on terminology and what it means and what is not. At the Healthy Communities Foundation, we happen to use the term Latinx as it is a gender inclusive and equitable term. And for us, terminology is very important, as it certainly conveys our values. However, staying on remembering the importance of the inclusive,ness but also the diversity amongst the umbrella term, so that we can cohesively work together, I think is one way to think about it.
Anna Maria, anything you'd like to add on this topic?
Yeah, I mean, if I'm asked to identify myself, I say I'm Puerto Rican Cuban. I mean, most of our folks, Maria, would probably, she wouldn't call herself in a cocktail party whenever we go back to cocktail parties, a Latina. But it's an umbrella term that was put together to simplify who we are as a community, because before that we were actually invisible until 1980. So it was created by the federal government for the census. That's the term Hispanic. At HIP, we use them interchangeably, although our preference is to use Latinx because it is more inclusive, but it's still fairly new. I think Latinx has only been used for the past 5 years. So if you ask my mom, she wouldn't know what that is. So it's I don't think you can go wrong using any of those terms. And most organizations will use them interchangeably. We're called Hispanics in Philanthropy, but that's also a creature of when we were birthed, right? In our DNA, we were created in the early 1980s. So that's when this term Hispanics came about. If we were to create the organization today, we might be Latinos in Philanthropy. But
excellent. Well, thank you for sharing. I know you also mentioned that there were regional differences in how this term is used, as well as demographic differences with maybe younger populations more familiar with this terminology. Anything on that front for our audience?
As far as the terminology by young people, one of the things that I can recall back is the first time I heard the term Chicana. I thought it was a Mexicana from Chicago, and so and obviously it's not. I'm growing up in Chicago. I thought, oh, I'm a Chicana, and certainly that's not where the Chicana was very much a term used in the Southwest. So we can go historically and politically as to all these various terms that politically at the moment are appropriate. I recall going back and forth in graduate school as to Latino versus Hispanic, and why Hispanic is so is or isn't appropriate. And yes, I'm a Mexicana of 1.5, meaning that I came to this country. So there are so many ways that we can identify and who we are. I think the important thing is, what does it mean to you, and how does it move you in this moment in time? Terms can change, but philosophy and values are what carries us in this work
I
and
think that
these terms.
I would also add that what's important is that you should add, just like we ask people for their pronouns, I'm she and ella, you ask persons, how would you like to be identified? And then you can't go wrong.
Wonderful. Well, I think that is going to be, I'm sure we'll receive lots of questions around that. Let's move towards an issue that I think has received a lot of attention in this moment, where there is more emphasis on racial equity and social justice. So based on recent data, Hispanic nonprofits, Latino nonprofits receive about 1.2% of the grants from national foundations. That number has fluctuated. Sometimes it's higher, sometimes it's lower. At Hispanics and Philanthropy, you both in your leadership roles have been advocates for the hiring of more Latinos in foundation and nonprofit leadership roles. So let's actually turn our attention to, how do we bring more diversity to the leadership table around funding allocations, but also how do we increase the nonprofit and philanthropic sector's diversity so that it is inclusive and we have more Latino staff, trustees, and grantees in the philanthropic sector. Any thoughts? Both of you have been very involved with this work, so I know that you can both speak very passionately about this topic.
Thanks, Una. I think the data you're citing comes from a project that we did with Candid, which is the Latinx Funders Dashboard, which is latinxfunders.org. And I was really distraught when I saw that, because I saw Marie Argilagos, who's one of our founders, he was commissioned by the Ford Foundation back in 1975 to look at the numbers. And he saw in 1975, when Latinos were less than 10% of the population, that we were receiving 0.8% of philanthropic dollars. And so we fast forward 45 years later, and we're at 1% of dollars. So it looks like it's grown a little bit, but in fact, given the increase of the population, it's a very big decrease in relative proportion. That worries me. Also worries me is that of the biggest private foundations in the country, 30% of them, 30, have absolutely no BIPOC people. So not only no Latinos, but they have no Indigenous, no Black, no Arab Americans. And how can they do a good job if there's nobody with lived experience on their board that is able to convey what is good policy and practice? In my opinion, this is not just a moral imperative. It's not the nice and the good thing to do. If these foundations are to achieve their mission, it just makes business sense that they have people not just at the C-suite and the pipeline of employees, but at the trustee tables as well. Maria was talking about Luz Vega Marquis. for many, many years, she was the only Latina heading a national nonprofit. She's just recently stepped down, and now we have Carmen Rojas, but it's only one Latina at a national foundation, not nonprofit, at a national foundation. We have lots of Latinas and Latinos in community foundations or in foundations in states, like for example, Maria. But this is not enough, not for a population that is going, almost 20% of the US. And so HIP, we're working to really center BIPOC leadership and to create tools so that these folks are ready to, because they are ready in terms of their life experience, their talent, and the values that they bring, but that they're ready in terms of the tables that they would be going to are ready to receive them. Maria, what would you add?
Yeah, I would add that we're a young community when it comes to influencing and leveraging the infrastructure to build wealth and power. And philanthropy is certainly about supporting each other in community, but also about building power of community so that community can continue to give back, right? So understanding that building that power, building the strength through philanthropy is important. But also, as I mentioned, I was fortunate to be on the board of another foundation, and sitting at that table with that lived experience, I brought a voice that perhaps would not have been there, and at that moment, looking at as I've heard, you come in and who else do you bring with you? It's important for us to think about in these moments, in these positions, how we continue to build the table and continue to build seats at the table, so that philanthropy just becomes better as a result. Bringing in more board members, representatives that are representatives of these communities are important, as it is to bring in Latinos and BIPOC folks representing various leadership positions at foundations. Again, bringing that lived experience, but also in these voices just makes philanthropy stronger. So I would say that that in doing so, opening these positions is also about strengthening philanthropy.
Excellent. So the key points that both of you have made is that diversity is actually a key ingredient in building a stronger sector. And so that leads me to back to the theme for today, building power. We know the 2020 election is days away, countdown has begun, and we have seen philanthropy increasingly working to bridge divides and to bolster civic engagement. What have you seen in this moment, especially about bringing on the younger generation and building advocacy on behalf of Latino communities? Is there anything that you are seeing right now that is very encouraging, either that you're doing in your roles or maybe in other spheres within the Latino community?
So let me just begin and then let Ana Maria finalize this topic that I think is so important. It is, to me, heartening. It is beautiful to see young people becoming engaged and motivated to speak truth to power, to be civically engaged. And I believe that as a result of that, we will have a stronger democracy. It is the young people who are standing up for a lot of the rights and issues that many of us have taken for granted. And so I think whether we look at the movement started with the Dreamers, that was a young people's movement. When we look at after COVID hit, and as Ana Maria was mentioned early on in the presentation how she was moved in Miami by the in a tragic, horrific attack. So have many young people today as it continues to say, no, enough is enough. And when we think of the Breonna Taylors of the world, that yes, enough is enough, we have a voice. So young people, I believe, are the spark to keep our democracy strong. And I am completely encouraged by that. So just
I would add, centering on the young people theme, centering leadership and leadership development programs. I have seen that come and go in terms of interest by foundations. At HIP, that interest has not waned because we know that centering the leadership skills of young people, we have our own Líderes program. That's really key, and investing in that is key. I think also important is year-round long-term investments in terms of, for example, we're talking about civic engagement, Una, that often dollars for organizing, mobilizing, often comes like in the last month or two, and you can't do that in the last month or two. It has to be year round. We work with all types of organizations, whether they be community organizers or health clinics or those that are focused on education. We also work with Main Street businesses, the bodegas, the beauty parlors, right? The taquerias, because that's where people go. Where are people convening, and where do they get their advice? Who are the trusted messengers? So working with the usual folks, but the unusual suspects as well, and doing it long-term, year-round. I would also add that we think about philanthropy just as foundations. At least it means if I talk to my mom, she'll think about philanthropy as coming from foundations. But philanthropy is coming also from unusual, unsuspecting places, and really think about how do you leverage all of these dollars in ways that are impactful.
Excellent. Well, we have so many questions coming in, so I'm just going to ask one final question to both of you before we wrap up. One area that we've seen in the last few years is the philanthropy toolkit being expanded. And at Hispanics in Philanthropy, you have added a new initiative that is actually focused on impact investing. So I wanted to ask if you can both talk about what brings you hope in this moment, and maybe weave in this notion of an expanding toolkit in philanthropy and how that can be powerful in this moment.
So happy you asked that. I think you're referring to our Power Up Fund, and that actually is relevant to what I was just saying. How do you cobble together the suspected, like people that you expect to be philanthropists, and those that don't think of themselves as philanthropists? So Power Up Fund was our effort to look at generating wealth, and wealth and capital has a moral lineage, right? And who has been able to accumulate wealth and who hasn't had the opportunities to do that, and looking at intergenerational wealth transfer. For our community, it's often these small entrepreneurs, and that's how they build their wealth. And so, especially with COVID and the danger, we've already seen that we've lost 30% of our businesses already now, the past 8 months. We wanted to make sure that we had a footing so that our businesses and our entrepreneurs were able to survive through these times. And once this recession is over, to stabilize in an accelerated rate. And the 2008 recession, we actually didn't regain our ground until 2 years after our white counterparts. 2010, our white counterparts were regaining and were pretty much where they used to be, and the Latino community didn't start regaining until 2012. So through our Power Up Fund, right now we're doing cash assistance to businesses, which for HIP was really novel and different because we had always done grants to nonprofits, right? So we're doing cash assistance to businesses, and that's going to be growing into a $50 million fund, which we're launching later this year, where investors, and by investors, it's high net worth individuals, but people like all of us here on this call today can donate $25, $250, $2,500, whatever, to really build the entrepreneurs and build a fund where Latino businesses can access that first friends and family round that we don't have usually access to, or the venture dollars, right? Right now, 0.25% of fund managers are Latinos. That means that fund managers basically don't know our community and they perceive our community as riskier. They're not riskier, it's just perceived as riskier. So we're trying to, by providing this first friends and family round, to provide that first funding and start demystifying that it's a risky community to invest in. And by this way, we're investing, we're really building our wealth and building other, more people that can invest and be philanthropists.
Wonderful. So Marie, I don't know if you have any closing thoughts in terms of what brings you hope, what innovation, creativity are you seeing in the Latino community at this time that you just want to share with our audience? There are tons of questions coming in, so I want to make sure we leave some time for those.
I think what gives me hope is that philanthropy has awakened, and unfortunately, it has taken COVID. It has taken some of the racial unrests that have taken place to bring light to the systemic inequities across the board and the role that philanthropy can play. So I truly believe that philanthropy is awakening to the importance of taking community approaches, the importance of investing in a way that that develops trust philanthropy with their grantee partners, and as we think about impact investing, I think foundations are looking at really diversifying how they can. Sure, we can give grants directly to nonprofits, but how else can we be socially investing resources for the good on both on our endowment side as well as into our grant making portfolio. So the two portfolios should both be diversified, if you will, and include that racial equity lens. So I have hope for philanthropy and really see what will be happening as a result of all this.
Wow, so thank you. This is excellent. And judging by the number of questions coming in, we're going to have to move through these as quickly as we can. One theme that has resonated with many of the questions is the question about engaging diverse donors. And as the Latino community is quite diverse, as everyone has noted, are there any resources that you have maybe identified or know of or can share with the audience, or even ideas about how do you engage? How do you, if you don't have an engagement strategy right now for this very diverse and growing community, as you said, now nearly 20% of our population, certainly the fastest growing segment of the US population, many nonprofits do not have a strategy. So some of the questions are really about how do we bring more Latinos to the donor experience?
You know, and I'm reading in some of the comments that Latinos, for example, don't participate in philanthropy. And so that's a charge for you all at the Lilly School, because that's really a myth. And when you start looking at it, you'll see that the community is really, really generous. And there's a lot of giving happening. It's just not been studied because it doesn't look like traditional philanthropy that we have here in the US. We don't necessarily do it through the United Way and through community foundations. So our names are not up on the walls, but the giving is happening. And so when you don't study and measure something, it's not valued. And I think that our philanthropy in our community is not valued, and it doesn't have the influence that it could and should. So please let's get some of your students working on this and studying it, because there are lots of good stories to tell. But when I talk to foundations, I talk to them about, like, what about giving circles? You know, we're very relational in the Latino community. I mean, what I miss so much right now of this world is that we can't really do hugs. These virtual hugs just aren't making it for me. And we tend to give to faces. We tend to give to, like, Doña Juana, who runs the bodega, or to the lady that's on the street, right? Because we know them. And we also maybe have a distrust of institutions because they haven't done so well by us. Look at what's happening in our federal government right now, which is, you know, really highlighting xenophobia as it's okay, that it's putting our kids in cages and the detention. So institutions haven't been so great for us. So we tend to give to people, but we give a lot. And we see that, for example, in Puerto Rico, after Hurricane Maria, the government is only now sending money 3 years later, right? So how did Puerto Rico survive these past 3 years? It was because of the grit and muscle and the resilience of the people on the island, and the diaspora, and a lot of allies that sent money and all sorts of other things. And so when I talk to community foundations, I talk to them about giving circles. Giving circles are really important. We have tremendously fabulous giving circles that are all across the country. At HIP, we're now starting also digital giving circles to help close that. But there's a lot of giving that is happening. Maria, what would you like to add?
Sure. Well, you know, one of the things that I, as thinking about this, I reflect on a study done by the Lilly School on how, a number of years back, specifically from giving from a gender lens. And if I recall, the study was something to the fact that women who, individuals who made less than 30,000 a year, gave at a higher percentage rate than individuals, you know, and the higher your bracket of income, the your percentage rate of giving back went down. So as we think about how philanthropic our communities are in the Latinx communities, I think back to having worked back when I was running a nonprofit and working with individuals who were on the lower income bracket. And I can tell you, they were giving at high, these Latina women were giving at very high rates percentage wise, to the point where when there were mail appeals, they were the first to respond. And so, you know, I think it's very important for us to think about, not just from, certainly the fact that Latinos are relational. Philanthropy is relational, right, as a whole. But if we think about the communities, and if more research is done specifically on communities, and as we think about COVID, I cannot think of a more philanthropic grassroots efforts being done with the señoras, the health promoters that are out knocking on doors, making sure that food is, that individuals that need food get food, that folks that need services receive them. So, you know, I think that there's a need for data at the very hyper local perspective to show us how philanthropic the Latino communities are.
So there's a call to action here, more research. We need the data, which is excellent. And that's a great call to action for us here as well, but for the sector as a whole. And then I think this definition question, how do we expand the definition and meaning of philanthropy so that it includes all the different ways that people give, both formally and informally? We've also received a number of questions on the funding side. So one specifically group of questions says, foundations that want to fund more Latin or Latinx-led nonprofits or leaders that are from Latino and Latinx communities. I'm using these terms interchangeably, as you've suggested. What advice or recommendations, how would they get started? Because we also have funders who want to perhaps start changing their strategy so that they are more inclusive and have and center on race and equity. What recommendations? Do you have any resources that they can turn to?
Sure. I just answered that one actually in writing.
Oh, you did? Okay,
yeah,
perfect.
But what I said is you could turn to, for example, organizations like HIP, who that's a lot of what we do. We provide advice to donors. We're working with like Bridgespan, with Bridgespan, with Blue Meridian, and individual donors. I'm talking to an individual anonymous donor this afternoon who want to understand how and where their money is most effective, whether that be into services or into systems change. There's also a really great tool, which is the GuideStar Seal of Transparency. And I sit on the board of Candid, but it's still, with all due respect, it's the best tool out there because that gives you a consistency in terms of these questions and how they're answered, because otherwise you might not get the same consistency. But that tells you what is the diversity of the staff, the board, the leadership, and where their dollars is going.
Excellent. Maria, anything you might like to add in terms of resources?
Well, in the Chicago area, we have been involved with a COVID mapping project, and specifically looking at the Chicago area, but it's a tool that could easily be used and replicated outside of Chicago, outside in various states from a county perspective or a state perspective as well. But the COVID mapping allowed us to put in a racial lens to the maps and how COVID was affecting various communities. It also, one of the, in this partnership, we asked a number of our philanthropic peers to share with us the data of were they supporting, were they funding in various communities? And the question was, are you also asking the representation of the organizations that you're funding? Are they BIPOC led? What is your definition of BIPOC being BIPOC led? And how, of those dollars, of those resources, how much of it is going to BIPOC communities? And so, I think the conversations are beginning and they're starting, and as a result, more foundations are starting to ask, are these resources going to BIPOC-led organizations as well? So I think this mapping project has shown the spirit, again, that spirit that philanthropy has come to really respond in this moment in time, includes the importance of responding from that racial equity lens.
Fantastic. So there are more questions than we can get to, but I wanted to group probably a few of them together and see if we can answer just a few more. One question is, with so many issues facing Latino and Latinx communities right now, as a donor, how would you recommend prioritizing? What are the key areas that are sort of number one on your list, or should be number one? It's very hard, I think, for many donors. What I'm gauging just from the questions is, where should I give? There are many worthy causes.
That's an amazing question. And I'll just speak briefly and turn it to Maria because I'm like she wants, but I would say, think about both the short term and the long term. Think about the immediate relief and services, but also think about the longer term and the systems change. And some of our most successful initiatives are with funders that are able to understand that you need both of those. If we focus only on relief right now, we're going to be doing relief forever and ever. And so right now we're doing a lot of relief, but we're also thinking about recovery and how do we recover and build back better. And those grants that allow for both, that includes maybe narrative change or organizing or voice and leadership development, those along with the very urgent needs of relief, that I think are the most successful and where I would do the donor education.
Yeah, I think it truly is. I think if anything COVID has taught us is the importance of a systemic approach, and that the social determinants of health are key. So not only is it important for us to have a good health system, we're going to have access to it, food, housing is important. Education is important, but certainly a systemic approach is truly important. And so I would say if there is an opportunity to really look at not only addressing things from a systemic perspective, but also looking at the root cause. Yeah, that if anything, COVID has taught is the importance of collaboration for that systemic approach, and partnership, but also, addressing that root cause.
At HIP, our North Stars are really racial and social justice and equity, and also what we need to address in terms of the systems change. And my colleague Hilda is on the phone somewhere with these 200 people, and she'll say, yes, thank you. Climate change and environmental justice. Latinos, many of us work outdoors. And so we see firsthand what's happening with climate and the climate change. And a lot of what you're seeing in Central America, I mean, it's been years of destabilization, but in the past 10 years, you see that a lot of the reason that there's so much turmoil and people are being dislocated is because of climate change as well. And that has to be addressed. And the emergencies and all the disasters that we're seeing, the fires, the earthquakes, the hurricanes, I mean, we have to address that.
Well, this is a long list, I think, for both donors and for our students who are on, and all nonprofit leaders as a whole. I guess we have just a few more minutes left, and there are a number of questions. I would add one last question for both of you that I think picks up on a lot of the themes that have come up. So both of you are in a unique position. You're grounded in your local communities, but you also have this national and, as you shared, even global perspective to view some of these issues. What recommendations would you have for nonprofit leaders and some of our students as they approach these issues to make sure that they center on race and social justice and equity? Are there some key, just as you outline this framework for donors, what would you say for our leaders in the audience?
Maria, do you still have Luz's book there on your?
Oh, I do.
What is it? Listen, no, ask, listen. Yeah, ask, listen, act. That's what comes to my mind. She just released this book like a week ago. And there's amazing leadership lessons in there. But yeah, it's sort of like, and you talked about it earlier. It's like, I worked in the federal government. And I remember we were putting policy together when we hadn't even been to these places. And when I started working, I was like, no, you have to go visit. And what my colleagues realized is that often what seems rational to us from where we're sitting, wherever that might be, is irrational when you're sitting in the seat or in the place where of the persons that are affected. And so you do need to listen and ask before you act. And as a person in a leadership position and a decision maker, I think it's even more important.
Maria, can you hold up that book one more time? I think that's a great place. So it's ask, listen, and act. Those are powerful words for all of us. I'm going to give Maria just 1 minute is all we have left, perhaps to jump in with some thoughts to leave our audience with as we navigate this crisis and all the turbulence that our world is seeing right now.
I think we have COVID-19 has brought to light the interconnectedness that we all have, and that we really are our health and well-being is connected to the other, our brothers, our sisters, health and well-being, and our neighbors, and so philanthropy is reciprocal, it's interconnected, and as we think about our role, we're our granito de arena, as we call it in Spanish, or we all have something to contribute, and in this role in philanthropy. And so whether it's doing it via non-traditional philanthropy or traditional philanthropy via giving circles, I would say give back, and go out and get this book, Ask, Listen, Act. I really enjoyed listening to, or I felt that I was listening to Luz speaking today. And this was not meant to, we were not selling Luz's book. It's about supporting each other's BIPOC authors and hearing different voices in philanthropy.
I'm reading another one, actually, Maria Hinojosa's book. And many of you who listen to NPR or PBS know her, Maria Hinojosa. And that book is fantastic. And those of you that are interested in like the legacy of why we are where we are, you would like that one as well. But I think picking up and closing with one of the things that you said, Maria, it's like, don't wait for the perfect. Just start now, get involved. There's lots of resources. HIP is here, HIP online, hiponline.org. Contact us. You don't have to be a foundation to be a member of HIP. We have, like for the students, we have students can be members, individuals can be members, or you can just sign up for our listserv or just follow us on Twitter. And it's a great way just to understand and follow what's happening in the community. And again, to get involved, start small, just start. Mm-hmm.
Well, thank you to all of you. It has been such a delight and an honor to spend the afternoon with all of you. And I also want to thank our audience for being so engaged and sending us so many powerful insights and resources to share. We will take all these questions, and where we can, we'll respond to them. Thank you again. Continue to stay well. And we welcome all of you back, hopefully, when the crisis abates and we can have Anna Marie and Maria in person at the Lilly Family School. Thank you again on behalf of the Lilly Family School and the Mays Institute on Diverse Philanthropy. Bye-bye.
Thank you. Bye. Thank you.